to Tonino.
Thank
Thank you very much, Catherine, and good morning to everyone. For the next 10 to 15 minutes, I would like to share with you the initial findings as to how these vulnerabilities have an influence on how we interpret what's happening with children passing through the youth protection services, and particularly those who are taken into care or who are sent to foster homes or foster families. Now, I know that you all want to see examples of these data, so I'll follow on from what Catherine has said. And I'm going to present to you a few examples. There's a whole range of information, in fact, that we have co-constructed or considered together with people from social pediatrics, as well as the different ministerial departmental representatives. So what do we see here? It's an information matrix. Sorry, it's very small, but you can refer back to the report that we find on the social pediatrics website of the Dr. Julien Foundation. What does this show us here? It's an information matrix, as I said. And this allows us to see the information about the three main indexes, the concentration of services in youth protection, and also the schooling of children, and also the vulnerability of families with children in terms of socioeconomic deprivation or poverty. And then we add another layer. We add other information where we break down schooling for the proportion or the percentage of young people who drop out at high school, and also a measurement of the density of this related to the average. We also have information about the schooling of elementary school children, where we consider the percentage of children in primary school who are lagging by 1 year, and we compare that with the density of the average, and then we compare this with the density of the children also per square kilometre in absolute figures and per square kilometre. That's how we break it down, and that allows us to understand how easy also it is to move around within the CLC unit, and there we look at the different public transport units per square kilometre. So if we come back to the example of North Montreal, sorry if you don't hear me very well with the mic, but if we come back to North Montreal, we can see that in North Montreal, the score amongst highest in terms of the CLC territory, where there's a high economic and socio-economic vulnerability, but there's 1/4 of the kids who drop out. That's 34%. 1 out of 10 of the children in primary school are lagging behind by at least 1 year, and that represents 30% higher than the average, and that's a CLSC territory. We've got 1,400 kids per square kilometre, where their access to public transport is about 27 units or 27 bus stops or for public transport per square kilometre. So that gives us indication per CLSC territory. But we should not necessarily draw comparisons between one territory and another. It just allows us to understand this territory in and of itself in terms of the vulnerability associated with these children on this territory. And there was something that was a big surprise, and that's why this is a very significant study, because when we break this down further, and the main indicator here, the poverty indicator, the child poverty indicator, to which lots of other vulnerabilities are associated, we find that with this poverty, there's certain pockets of poverty or enclaves of poverty found throughout Quebec, spread throughout Quebec, where we can find a CLSC which is not described as one of the most vulnerable CLSC territories when we aggregate the families and children that are at risk. But yet within this territory we find some pockets of poverty where the families and children are amongst the most at risk in Quebec. So that's why it's so important to carry out these more refined, fine-tuned analyses that go below the level of the CLSC territory. We've been able to do that with poverty or the socio-economic underprivileged populations. And then if we look at this last column, it indicates the percentage within a CLSC territory where there's an aggregation of children and family who are among the poorest in Quebec in terms of being in the first quintile. They're in the first 20%. So if we come back to the example of Northern Montreal, 67% of the CLSC territory of North Montreal has aggregates of children and family who are amongst the most at risk in Quebec. And we can read this in the same way for all of the CLSC territories. Where are these children found? That's what we wanted to understand. So here, with a quantitative point of view and with figures, we can actually track down these most at-risk children. And then we come back to the map here, and if we can launch the video, we'll give you an example of all of this. Here it is, up on the screen. So you can see the island of Montreal. The red zones represent the aggregates of family that are vulnerable, that are at risk. They're in the first quintile, they're in the top 20%. And with the island of Montreal, we can see that it's spread throughout the island, these red zones. And we find the same phenomenon throughout Quebec. If you look at the same map for the whole of the province of Quebec, we find exactly the same thing. Let's directly zoom in on Hochelaga, Maisonneuve in the north of Montreal. That allows us to understand these red zones better. And we can also see that in these hotspots, in terms of vulnerability and poverty, they are adjacent sometimes to families with children who are amongst the least vulnerable in Quebec. And then we can look within the zone of Hochelaga Maisonneuve, where we've got Dr. Julien's clinic. It was the very first one to open, I presume. And there we can understand the physical environment of the child and how easy it is for them to move around the different zones where there's green parks and green spaces and the opportunities for the children to go out and play and enjoy themselves. And let's look at the scale of Montreal now, and that gives us an indication of the overall territory. And we've done exactly the same thing, but we've rolled it out across Quebec. And I'd like to recognise Benoit here. Benoit, go for it. Benoit is a real champion. He works for the Dr. Julien Foundation, and he's created this map that he's continuing to fine-tune over time. So that gives you a great indication of these data. Generally speaking, you can see how we can use this information when we're addressing this issue of how we're offering services. How can we intervene in these different communities, and how can we intervene in these poverty enclaves and understand the children's needs? How can we understand this question of accessibility and availability of the services that already exist with these children, and add that with other measures such as subjective, qualitative measurements, so that we can really dig down, as Dr. Goldfeld mentioned earlier. That gives you an overall idea of the project, and I'd like to push the envelope a bit further and ask to what extent how all of these different vulnerabilities in the population explain differentiation in terms of the youth protection services. Up here we see the percentage of children who are taken into care by region, and that covers the last decade in Quebec, and we can see that there's regional variations of 72%. That's the variation. And we should note from the outset that the great majority of children who are taken into care don't actually get taken into foster homes. 22% are going to go into substitute homes, if you like, and there's this variation of 72% across the different territories. So how can we actually explain some of this variation, these swings, if we take into account these vulnerabilities in the population? We decided to dig down with a longitudinal multi-level study. We follow 122,000 children who have been taken into care over the last decade, and we can see the different lines here and the regions where we've got the 0 to 5 years, or 0 to 4 rather, and then 5 to 11, and then the 12 to 16. And we've got this curve distribution where we say that the infants and adolescents are the ones that have got the highest percentage of being taken into care. The needs associated with the age of the child and their well-being and the development of that is different. For example, the needs of a teenager taken into the youth protection services are different from an infant. So we've separated this out into 3 models. For the 0 to 4 years, we've got a multi-level model, and we take into account all the different risks that we've observed in terms of the youth protection services. And we also include extreme poverty in here, as well as relative poverty and expenditure in terms of social services at the second level, at the regional level. So what we find at the first level here, at the level of the child, we find that the vast majority of the risks of being placed are explained by the lifestyle of the parents, which represents a category that's very much related to risks of negligence, physical negligence, health, emotional, psychological. The lifestyle of the parents often linked to addictions, severe mental health problems, a high-risk lifestyle, in other words. And it's also interesting to observe here that individualized poverty associated with families explains that there's a higher probability of 0 to 4-year-olds being taken into care. And then for the 5 to 11-year-olds, we can see that the risk remains in terms of negligence and the categorization of the different types of negligence. But we're starting to see for the older ones, the 6 to 11-year-olds, and in particular the 9 to 11-year-olds, that there's behavioural disorders that are starting to increase in size. And once again, there's the individualised poverty of the family, which has an influence on the risk of them being taken into care. Whereas for teenagers, it's very much related to their behavioural disorders. So we can see this was a story they would observe before. That was a study that had already been published. But when we take into account poverty at the second level, because we've already measured poverty at the family level, at the child level, but if we pass on to the next level and we take into account the differences in terms of regions with these different pockets of poverty, and we look at the percentage of people who actually receive last recourse social welfare payments, and where they've got there's a percentage of low-income families, and also the expenditure for social services, and we subtract the youth protection services for young people in vulnerable situations. What does this show us at a multi-level? It shows that if we add in these different poverty categorizations, that explains an increase in the rate being taken into care, and it explains 57% of the variation in the use of being taken into care across the region for the 0 to 4 years. It explains 38% of the variation that we see through the regions for the 5 to 11, and it explains 0% of the variation for the teenagers, because many of them come because of behavioural disorders and are taken into care. So with this same analysis, all of this is preliminary, but even if it doesn't explain the actual aspect of being taken into care and all of the variation, or the variation indeed for teenagers being taken into care, once they've been taken into care, it reduces the probability of reunification for these same teenagers. So you can see how we can use this information, and we can group together the databases, and the information remains objective and related to the population, but it's also nuanced because we're not able to break down not the experiences but the anomalies, as Dr. Goldfeld mentioned earlier, where you find neighbourhoods where there's significant poverty but things are going well for children, compared to other enclaves where things are not going well at all. And we're trying to understand these differences and the different resilient factors. What means that in one environment one child's going to do better than another? Why? In terms of the project now, to close the loop here, these data allow the Dr. Julien Foundation, and also for other community services and the health and social services network, to think about the main big needs for these children and where they're found. And then we add to that appropriation about mobilization of the community leaders, consistency of the existing services, and the availability and the accessibility of these services, as well as the opportunity to roll out this network and develop more partnerships within the health and social services and education network. It also means that we can ask ourselves questions and dig down deeper and add in more information where we want to understand to which extent these vulnerabilities play a mitigating or moderating role in terms of risks and the well-being of these children. And as I've said, we want to go deeper and add extra information in terms of the fact that there's a shortage of food, there's not enough green spaces, and the question of mobility. And we also want to add in perhaps other types of qualitative information. So with all of that, I've rounded off the presentation. I'd like to thank the Foundation for the leadership that you've shown, the approach that you're taking. I'd like to recognise the contribution of everyone who's been involved in this project. It really wouldn't have been possible without collaboration between the different ministerial departments, access to data, and also the co-construction of the information and appropriation of the information, both within the universities, the researchers, the social pediatric clinicians, and those who deal with these social policies in the various departments, which have allowed us to understand all of this and develop this great project and collect all of this information. So I'd like to encourage you to continue with this culture of questioning yourself so that we can better serve the most at-risk children in our society.